We're now approaching 1,000 deaths a day, 6,000 to 7,000 a week. You don't need your GCSE maths to realise that we'll be over 100,000 by the end of January unless something miraculous and dramatic happens. We've got to take this as a wake-up call, and we've got to make the government do the right things in the right order and at the right pace. We need to do that. That's our responsibility, to hold them to account. Speaking personally, I'm beyond anger. We have people running this country who are incapable of listening, incapable of admitting when they get things wrong. They're very hot on distraction tactics and on blaming other people. But if you don't admit when you get things wrong, you're not going to get them right. And we've seen it over and over again with this man who's Prime Minister, who's got the leadership qualities of, I don't know, really, a dormouse on acid or something, really. I mean, it's just unbelievable. The lack of coherent planning, coherent action that's sequential, that makes sense, the narrowness of the vision that 1 minute puts public health in opposition to the economy, and the next minute is slaughtering the economy because of the failure to get on top of the public health issues. The lack of joined up thinking. This government is a second or third division government. It's not a Premier League government, and yet it claims to be going to take on the world now that we've left the European Union. I don't get it personally. I just wonder where the Conservative Party itself is on this, because they can't live with an incompetent Prime Minister forever. They will have to replace him with somebody who, at least gives the semblance of knowing what they're doing. And how long will that take before that 1922 committee gets together one Monday night and decides that the time has come? I hope it's soon. The story of this pandemic, as we've said so many times, has been doing too little too late in the beginning, with PPE, with testing, locking down too late, opening up again too early, not having the fire break, so-called at autumn half term, all that nonsense about 5 days of Christmas, then backing off again when everything was getting out of control in London. And yes, we should have locked down. It is better to be more severe earlier than having to do it later. I mean, this is quite simple stuff, and I don't know how many times you have to tell our Prime Minister, our Minister of Health, our other senior politicians this before the penny drops. And now, we are now getting the harvest of those people who were infected over Christmas. That's beginning to come through. It takes about 2 weeks for people to become seriously ill, and 3 weeks before they start dying. And that death toll is likely to rise over the next week or two. And then only, 2 weeks or so after the lockdown starts, will we hope to see the numbers plateauing and beginning to come down again. I feel desperate for these small business people who've not had any access to money from the government, who've seen life's effort, their passion to build up small businesses get ruined because of the inconsistency. These bars and restaurants that have been marched up to the top of the hill and marched down again several times, having to buy in stock and then it goes to waste. This is no way to run a country. People cannot run their businesses with this kind of lack of coherence. It's better to get on top of this once and for all until we got the vaccine sorted out, and then ease off in a way where people can plan for the future, reinvest, rebuild, get their lives back to normal. Many thousands of people have died unnecessarily, and it gives me no pleasure to say I predicted that was going to happen unless the government got a grip and acted decisively and in a timely way. But we've seen what's happened over the last few weeks, the complete lack of decisiveness, the changing of minds all the time. You couldn't get more confusing for the public than what's been going on, and sending millions of children into school for one day so they could go mix the virus if they'd got it over Christmas, mix it up in the classroom, and then go home to incubate it again. Brilliant stuff. I mean, you know, you couldn't make it up, really. And day on day, the cases are going up. It's particularly bad in London and the southeast, but it's spreading across the country very fast now. And the hospitals are full. You're not getting the full story from the hospitals because the hospital managers are all censoring what they say. They're under pressure to tell a good story. But we're sending patients over to the southwest, to Bristol, because there aren't enough beds. And you can bet your bottom dollar there are people not being admitted to hospital who should be admitted to hospital because there aren't the beds. And so, as I predicted back in the spring, people will be dying at home. Very seriously ill people will be at home. We need to be making sure that families get the right support if they're nursing sick relatives at home. You know, I'm hearing of people where they've not seen a GP or a doctor or a nurse, and they're very ill at home. This is really bad, and we're given a story all the time, and the Prime Minister's now got on. He's left all that behind, all the mess, different areas of mess. He's left behind the school mess, and he's now wanting to just talk about how many vaccines they're doing every day. And, you know, 1.3 million yesterday sounds like a big number. That's 2 weeks. They want to get to over 30 million people by the spring. And you just do the maths on the back of an envelope and it's not going to happen. Prime Minister's telling us all the most vulnerable people are going to have been vaccinated by the middle of February. How can that be when we've got this situation? We've got the leader of the opposition saying we need a vaccination centre on every high street. Well, I can tell you, I've been trying to register as a vaccinator, as a semi-retired doctor, and I've got many colleagues in the same position. It's a nightmare. There's an online system of registration and training, large numbers of training modules. Some of them are sensible, to do with the knowledge about the vaccines and the particular issues with them. And then you get on to fire safety, heavy lifting, and all kinds of bureaucratic requirements that you would need if you were applying for a job in the normal circumstances in the National Health Service. It's, you know, it couldn't make it up. It's been put together by people who've got no sense of urgency, no knowledge of what's important and what's not important. And I can see this being the next big crisis because they need tens of thousands of vaccinators to be getting this out there. There clearly is a new variant around, but there have been several new variants around since September. And we've known about this one since then, it seems. Why didn't they act on this when they knew it was coming down the track? Why did they press on with this reckless pursuit of, you know, we'll be back to normal by Christmas, 5 days of Christmas? It was political. And then it got so bad, they had to pull the new variant out of the hat and dress it up as being the reason why, you know, they'd had to backtrack on Christmas. But they were always going to have to backtrack on Christmas. It was coming already. You know, this is the problem. And then, you know, all of this contributes to the lack of trust with the government. So whenever they say anything, you're now thinking, well, is that true or isn't that true? Sometimes they're bound to tell the truth, but it's very difficult to know when it is. And as I was taught as a kid, it's always best to tell the truth because then you'll remember what you've said. I think that the politicians have been behind. I think that they've been in a state of ignorance, in a state of denial. I think the composition of the House of Commons and the House of Lords is deficient in scientifically literate people. I think the nature of the parties means that it's difficult for people who, are going to take a different view to stand up and stand out and speak out. They've become very much controlling bodies, these political parties now. Somebody like myself, who's independent-minded, gets branded as a maverick or a mad professor or something of that nature. This is not healthy for democracy. We need views. I mean, I have always argued for the underdog. I always depend on being able to support my statements by evidence and experience. But when it's not, helpful to people in their belief systems, then I often come in for stuff like I got last spring. This man Stephen Barclay on the Question Time, who's, another one second-rate politician who's in the Treasury. We don't do well for our politicians at the moment, I'm afraid. If you look back to the days when I was a teenager and in my early professional life, we had some strikingly competent politicians across the political spectrum. Today, that's not the case. We've got a problem with the quality of our politicians in public life. On one hand, what we're seeing here is a failure of the leadership of the politicians and so on. On the other hand, we've seen there is a vibrancy at grassroots level, the frontline level here. I used to have a car bumper sticker that said, "If the people lead, the leaders will follow." And that's what we've seen over the last few weeks. We've seen that with the frontline health workers. We've seen it with the teachers. We've seen it with other groups. Everybody needs to be in a union, because in situations like this, a lot of people will find they've got nobody looking after them in their corner. Small business people need to be in a union. They need some representation to argue their case. It's a ruthless world out there, particularly when you get into a crisis like this. The Prime Minister's many times drawn comparisons with the Second World War, and for me, we've had Dunkirk. We've had to try and evacuate everybody off the beaches and get them back into their houses because the virus was raining down on them on the beaches of Normandy. We've had that, and we've now retreated back into the houses. But we've also got the May Blitz of 1941. The German bombers were coming over every night for over a month and bombing London and Coventry and Liverpool and the other port cities. This virus is bombing us all 24 hours a day at the moment. That's what's going on. The virus is the May Blitz of 1941. We've got to get through January. We've got to get through February. And I was hoping we'd have cracked the vaccine thing by March, but we may well not have cracked it now till April, May, or even later if we don't deliver on this program. And it's some of the same stuff. It's trying to run this from London instead of giving the authority, the power, the resources to the regions and the big cities, and to the county, to the Shire counties as well, who have the administrative arrangements to be able to do this stuff for themselves. I think we do have to love and look after our neighbours in this crisis. The interesting evidence from mental health research is that when groups of people or countries are under threat from outside, then paradoxically mental health can improve because of the solidarity that can come. That suicide rates tend to go down in wartime. During the Troubles in Northern Ireland, suicide rates went down. People were galvanised around what was going on. I'm afraid there's been a fragmentation during this crisis. People have begun to take up positions and to disagree with each other and to become really militant. And that's unhelpful. What we really need is the spirit of solidarity, which was around last spring, when groups of people spontaneously got together to support neighbours, to do the shopping and keep an eye out for older people and so on. That's the spirit that we need. We need to re-invoke that. People need to love one another and they need to look out for one another. And the Prime Minister needs to stop claiming that territory when he's not occupying it by doing things that undermine trust constantly. I've said it before. He needs to confess that he's got it wrong. He needs to go and see a priest and make a confession. And he should say some Holy Marys or something, because then what he needs to do is start doing things properly, being open and transparent with the public, and opening up the control of this across the parties and devolving it to the local regions, the city mayors, the town halls, and the shire counties. That's what he needs to be doing. And we need to make him do it. If you want to understand what's likely to happen over the next 6 months, you should read my book, Blinded by Corona. Remind yourselves all the things the government got wrong last time. Lobby the Prime Minister. Stop this death toll, which is going to go over 100,000 later this month. Let's do something about this together.